And although there are no reports of measles cases in Bexar County, health officials are monitoring the situation after someone who tested positive for the virus visited the Alamo City. As KENS 5's Sarah Duran explains, doctors say vaccination rates are strong, but positive cases are still possible, and children are usually most at risk.
So this double-dose vaccine is usually administered to kids at a certain age. Some children could be too young, while others may have only received one dose or no dose at all. And Bexar County schools have a much higher vaccination rate than Gaines County. State records show 94% of kindergartners were vaccinated against measles last year. However, several school districts are below herd immunity, most being private or charter schools. But there were some bigger ones below 95%, like NISD and EISD and Edgewood ISD. Doctors say the best protection is receiving both doses against the virus. However, some people can't get the shot for different reasons, so the thought of a possible exposure here in San Antonio is concerning. University Health chimed in with this Q&A video.
If you're immunocompromised, there's a lot of things you have to think about, including measles, right? You need to think about what your risks are and go in crowded public spaces. You should try to avoid people that are ill. You should do good hand hygiene. During time periods of high transmission of measles or other viruses in your community, you should consider wearing a mask if you're going to crowded indoor settings.
If you think you have been exposed, watch out for symptoms like cough, runny nose, and itchy, watery eyes. A rash is also a clear indicator on your body. If that's the case, call your healthcare provider and explain what's going on so they can take the proper precautions to reduce the risk of transmission to other patients in a clinic setting. In the studio, Sarah Duran, KENS 5.